What we're going to talk about during this section is the initial treatment of C. difficile with either metronidazole versus vancomycin, the two original core treatments of this infection. And there are really two main studies that looked into this. One was a study that was conducted between 1994 and 2002, where they looked at patients who presented with C. difficile infection, and they were randomized to either receive metronidazole 250 milligrams 4 times daily versus vancomycin 125 milligrams 4 times daily, and then they were followed for recurrence, or whether or not they had another episode in the future. The patients were separated into those that had mild infection versus those that had severe infection based upon pre-specified criteria. Within this study, those individuals that had mild infection had a response rate to metronidazole of about 90% versus 98% for vancomycin, and recurrence rates were 8 and 5% respectively. Now, during this study, being conducted between 1994 and 2002, it was deemed that there was no statistically significant difference between metronidazole and vancomycin in those with mild infection. So originally, about a decade ago, it was recommended that we use metronidazole for initial infection. In the severe cohort in this study, though, there was a statistically significant difference. Those patients that received metronidazole responded 76% of the time versus 97% for vancomycin, with recurrence rates of 21% for metronidazole and 10% for vancomycin. Plainly stated, vancomycin was a much better antimicrobial for the patients with severe infection. And in those guidelines that were published 10 years earlier, 10 years ago, it was recommended that we use vancomycin for initial severe infection based upon this study. The only other well-performed study that looked into the future at patients that presented with C. difficile infection, so-called prospectively, was a study by Dr. Stuart Johnson. And the original design of the study was to compare metronidazole and vancomycin as control groups with talavimur, a new potential treatment for C. difficile that bound to the toxins that cause the diarrheal syndrome most commonly associated with C. difficile. Unfortunately, talavimur was not effective. However, with us having the two control groups of metronidazole versus vancomycin, we got prospective data that was very, very useful. This study was conducted between 2005 and 2007, and what you'll see in the right-hand bar graphs is a grouping of the two sister studies that were designed identically. And when the two studies were combined, we see that vancomycin overall was a superior antibiotic to metronidazole for the treatment of C. difficile infection, with response rates of 81.1% for vancomycin versus 72.7% for the metronidazole. This was largely driven by the severe cohort. In this study, the severe cohort responded 78% of the time to vancomycin versus 66% for metronidazole. Plainly stated, vancomycin, even between 2005 and 2007, was a superior antimicrobial to treat C. difficile infection than metronidazole. And this is the reason why in the updated Infectious Disease Society of America guidelines, metronidazole was largely removed as a treatment for initial infection.